The Abdu Katuntu-led task force today opened proceedings by investigating how ministries, agencies and departments utilized funds allocated for the COVID-19 interventions.
We are not here for fault finding.
Task force members first interacted with the Director General of National Medical Stores, NMS, and Finance Minister Matia Kasaija. For NMS, legislators demanded to be updated on how far with the procurement of COVID-19 vaccines and personal protective equipment, which are lacking in many government health facilities. It is at this point that the Director General of NMS, Moses Kamabari, revealed that the Health Ministry had taken over the responsibility of procuring vaccines and PPEs despite being their mandate.
We have government institutions all trying to do procurement of drugs, of supplies. And I think this is where the problem is. I hope the Minister of Finance gets this point.
Unless the law is saying otherwise. But if it is just a matter of practice, I am not bothered who procures. As long as it procures according to the law, we get the best deal and they have a contract with the supplier.
For provision of health commodities, medicines and other health supplies, it would be better for the funds to be voted directly to national medical stores than going through the Ministry of Health.
Section 4 of the National Medical Stores Act 1993 mandates NMS to procure, store, distribute and supply medicine and medical supplies. In February 2021, Parliament allocated 18.3 billion shillings as deposit in procuring 18 million doses of AstraZeneca vaccine for 9 million people. Finance Minister Matia Kasaija was asked who between NMS and Ministry of Health he allocated the funds.
Was money appropriated for vaccine? Why didn't we get the vaccine? Was money released? It was released to
I
who?
represent Entebbe municipality.
I don't remember the real details, but if the request came under Ministry of Health, the money will go to Ministry of Health.
Will the Minister of Health procure the vaccine, eventually to end up with him?
However, the MPs were shocked to learn that despite the shortage of PPEs in many health facilities, there was a batch of them lying idle in NMS facilities. According to Kamabari, they are still waiting for instructions from the Ministry of Health, who procured on when they should be supplied.
Do we have enough PPEs as a country? 2, when can we expect the whole country and health workers in particular to have PPEs as instructed by Ministry of Health?
That all the PPEs that we have in NMS, the ones that are related to COVID response, are owned by Ministry of Health. So we are warehousing and distributing upon their instructions.
Parliament, our concern is, why is it that we have several donations and also some procurement that has taken place, but back in our hospitals, people are suffering. Even the forefront soldiers, the medical staff, are not getting the basic things like protectives.
The Ministry of Health is expected to appear before the task force on Wednesday next week to give its position on the matter. Habad Ziwa, NTV Weekend Edition.